Thank you all for being here today. We are obviously here at the UPS location in Austin, Texas for what is going to be an extraordinary day as Texas continues to take steps to conquer COVID in our state. I particularly want to thank our host for the day, Nick Dandra, for his connection and his leadership with UPS, working collaboratively with the state of Texas to make sure that we are able to distribute the COVID vaccine across the entire state of Texas. Operation Warp Speed is a monumental medical miracle that is on a daily basis now saving lives and beginning to restore normalcy in our community. And I want to thank UPS for the role that it plays as the primary deliverer of this transformational medicine that will help Texas get back to normal as quickly as possible. Texas has been a national leader in being able to structure a system to achieve this fast, effective, swift distribution of the COVID-19 vaccine. We have more than 7,000 providers that are lined up, prepared to distribute this once they receive the medicine from UPS. Right now, the lead recipients of the COVID-19 vaccine are our doctors and nurses on the front line. I got to tell you, it was moving. It was heartwarming to see the doctors and nurses who received this vaccine just yesterday or the day before literally break out in tears as they knew that they were receiving medication that was going to protect their lives. Everybody owes a debt of gratitude to these doctors and nurses who have been on the front line for months now. The warriors at the tip of the spear, working around the clock, sacrificing their own lives for the health and safety of their fellow Texans. We cannot thank them enough for risking their lives to care for others. And that is exactly why they are in the front of the line, so that they will be able to be vaccinated, so that they will be able to continue to serve on the front lines, helping others who are coming in with COVID-19. In addition to that, we are beginning the process of making sure that we are able to get the vaccines to our most vulnerable residents in Texas, and that includes especially those who are in nursing homes, who are seniors, especially those who may have comorbidities or other types of healthcare issues. As General Perna put it, when I was in Washington, D.C. last week for the White House Operation Warp Speed Summit, he said that we have one goal, and that is to save lives. And Texas has a distribution system in place to make sure that we're stepping up and doing everything we can to save lives. And that's exactly what you will begin to see. Let me explain a little bit about how this process works. This is a very carefully calibrated process about how we go about distributing the vaccines. Each week, Texas, as well as the other states, gets a weekly allocation about the number of COVID vaccines the state will be receiving for that week. During the course of that following week, there will be several days during which UPS will be making the initial delivery. Right now, because of the cold chain process that's involved in the Pfizer vaccine, those deliveries are going to about 110 hospitals, from which there can be additional distributions. And then next week, it is fully expected that Texas and every other state in the United States will be receiving not only the Pfizer vaccine, but also the Moderna vaccine. And so right now, the weekly allocations are along these numbers. Before coming out here today, before today, we had already delivered about 95,000 doses of the COVID-19 vaccine. Today, an additional 129,000 doses will be delivered across the state of Texas. So that means for this week, we have about 224,000 doses of vaccines that will be delivered. This is going to increase, as I pointed out earlier, next week when we have not just the Pfizer vaccine, but also the Moderna vaccine. And that will allow us to be well over 1 million people who will be vaccinated just in the state of Texas alone just this month. And those numbers will continue to increase as the production continues to increase and as both the Pfizer and the Moderna vaccines come online. Next month, and actually maybe even beginning next week and later on this month, we will be delivering to not just hospitals, but healthcare centers, clinics, pharmacies, freestanding emergency rooms, urgent care centers, long-term healthcare facilities will be receiving these vaccines later on this month, as well as local health departments, state hospitals, and state-supported living centers. We always want to make clear that vaccines are transformational, but there are some people who do not want them. And so vaccines in the state of Texas are voluntary, never required, but we will have a keen focus on who will be first in line for these vaccines. The last thing I'll mention before I pass things off to Dr. Hellerstedt is that in addition to these vaccines, there is another very important medical treatment that is available that we are strongly urging the holders of these vaccines to be more proactive in providing them to patients who need it. They're called antibody therapeutic drugs. One is made by Regeneron, another is made by Eli Lilly. There was great discussion when I was at the White House earlier this week about the urgency to make sure that these antibody therapeutic drugs are provided to people. They are sitting on shelves in the hospitals and other locations around the state, and that's not being used for the reason which it is intended. These are life-saving antibody therapeutic drugs that can be put into people who already have COVID-19 and help them recover and help keep them out of hospitals. One thing that we can and must do as we speak right now, and that is to use every tool that we have to reduce hospitalizations in the state. That requires every recipient and holder of these antibody therapeutic drugs to make sure they get them off the shelf into the people who need them, so these people are going to be able to recover and not have to stay in the hospital, and so that the hospitals will be reduced in the capacity that they're dealing with right now.